U.S. Surgeon General says there's been a recent spike in mental health disorders among America's youth, including depression and anxiety. A new program is designed to address the concerns in the New Orleans public school system. We're being joined by Children's Hospital CEO Lou Fragoso, who said he did not get the memo about it being National Seersucker Suit Day, but we forgive you.
Thank you. I appreciate that. Good to be here with you.
First of all, let's talk about this program because is it a unique program among school systems?
It absolutely is. It's truly unprecedented in its time. We're excited about the partnership with the City of New Orleans and NOLA Public Schools. It's going to make a difference for kids.
And how big of a problem is it right now with mental health and children? Because they're in a whole different world than when you were growing up or when I was growing up. There was no social media then.
You're absolutely right. You said it best. I mean, think about what kids are dealing with today. Violence, crime, social media, cyberbullying, single parents, no parents. You just heard language barriers, food insecurities, housing insecurities, and lost years from the pandemic. All of that has led to what you're seeing today nationally, which is 1 in 5 kids struggling with mental illness. And then you bring that locally, and it's worse for our kids locally. 54% of NOLA's youth have lost a loved one to violent crime. All that then drives a spike in depression, anxiety, trauma, grief, and that's why this program is so important.
And I was going to say, is it worse here in New Orleans than in other places?
I think, you know, we certainly have more challenges because of those things that I just mentioned, and I think one of the things that's special about our community, though, is how we come together. And that's what we're saying. As a hospital, we developed the ThriveKids student wellness program to deal with this exactly, which is how do we take our care and compassion from outside the hospital, bring it into schools directly where kids are at, and stand together with teachers, doctors, social workers, nurses to stand beside our kids in school and help them thrive.
And you have more than 30 mental health professionals who will be going to schools around Orleans Parish. What will they do for kids?
That's a great question.
And how do you know when they need help?
Well, that's a great question. That's what teachers, we've been hearing that from teachers. And I think what we've been hearing from teachers is they can't do everything and be everything for every child. And that's why it's so important to have these resources in school. So when kids start to decompensate in school, there's the social workers that are there to help support them right there in school. Then we can get them care coordination to other specialists that they might need. We've seen it work. We've seen it save lives.
So in effect, are you kind of nipping it in the bud before it becomes a real problem?
Yeah, it's really then taking our model and having it be a proactive model, going directly where kids are at. And I think that's really the important part here, is not waiting for them to come to us in the hospital or in the ER. It's going directly to them, supporting them in school, and then you're supporting the school teachers, supporting the school system, and it's really going to, think about it, if your kids are going to thrive in life, they need to be able to be in school and thrive in school.
And you know, 30 plus health professionals seems like a big number, but it's a huge school system. I mean, is that even enough?
It is. It's just the beginning. I'll tell you that. So we need to start somewhere, and this is the beginning of that, because it's not just having them in the school system, it's creating a centralized approach so you can provide this care coordination, and then schools that are the most at risk will have more people on site, and we certainly look to add more people on site in the future.
And at Children's Hospital, are you dealing with a growing number of mental health issues as opposed to people, kids who get cut or hurt or something like that?
It is one of the #1 things we face, which is why we've made such a big investment in behavioral health. If you look across the country, we have probably made one of the largest investments in behavioral health in the country. We built a 51-bed behavioral health hospital just for kids. It's the second largest in the country. We started the ThriveKids student wellness program so you can bring behavioral health resources directly to kids in school. We've invested in the outpatient side of it. So yes, it's an absolute crisis and it's a need.
And people may not know this, but Children's Hospital here in New Orleans serves a wide area.
We do. All 64 parishes across the state of Louisiana, including Mississippi and Alabama. So we are helping the entire Gulf South.
All right. Well, good luck on the program. If you want to learn more about the program, we have a link to the Children's Hospital website that has everything you need to know. You can go to our website, WWLTV.com, and click on links, and we'll get you where you need to go.